Okay, welcome everyone. Good afternoon. Thank you so much for being here with us today. My name is Caradina Sale. I'm with the McSilver Institute for Poverty Policy and Research and our Community Technical Assistance Center, CTAC of New York. So I welcome you today. And I would like to also welcome you to our webinar called Grief in Transition Age Youth. Which today's webinar is going to really provide an overview of working with grief and transition age youth. We will look at different definitions of grief and examine how they offer a framework for grief work. The types of grief transition age youth may experience will be defined with some examples, along with delineating how working with grief and transition age youth is kind of at times different than in children and adults. To conclude, 3 interventions will be discussed that can be implemented when supporting transition age youth through grief. So thank you again for being with us. And before we get started, I just want to take a moment to orient those of you who may not have been with us before. If you have been with us, I'm sorry, this will be a little bit of a repeat, but just want to go over some things about participating in today's event. So upon joining, you are placed on mute to avoid any background noises. However, we are in this together, so I am very active in the chat. And if you would like to speak with us, please chat in. Preferably to everyone, so to all panelists if you can when you're chatting. Please submit questions throughout your time because we will have a Q&A portion at the end. And you can, again, the chat box feature, which is located at the bottom. So you can chat into us questions or comments or concerns, anything that you're thinking throughout your time and participating with us today. For best viewing experiences, you can go to the top right corner and click view and click side-by-side :speaker. And that way you'll just see our presenter, Hart, who will be taking us through today's webinar while you see the slides as well. And so that's the best viewing experience. Thank you so much to Hart Haraguchi for presenting today. Hart is a licensed mental health counselor associate specializing in trauma and grief work. She is an internal family systems therapy trained therapist at level 2 and a certified grief counseling specialist. She also writes for Choosing Therapy, focusing on providing information about trauma, grief, and life transitions in an accessible and straightforward way. Hart, you are an amazing colleague. We're so grateful to have you present today, and I'm going to pass it on to you.
Lovely. Thank you so much. I'm so happy to be back here with you all. Kara did a great job just now of talking us through what it is that we're going to cover today. So we're going to start very quickly with some definitions of grief. We're going to take a look at different types of grief that transition age youth might be experiencing. And then we're going to move a little bit more into looking at the different frameworks that we can conceptualize the grief process from. And then take a look at how for transition age youth specifically, they might experience grief a little bit differently. And then to wrap up, we're going to talk about 3 specific interventions that I really like to use with this age group. And then we'll have time for questions at the end. So to start, if I can move the slides here, which I might not be able to. Oh, perfect, here we are. So I want to start with talking about why grief work is important, because for a lot of therapists, they aren't grief specialists. It's not sort of what they list as what they're working with. It's not where people tend to get a lot of extra training. And yet it is so important for all of us to have some information around how to work with grief, because this is one of the very few universal human experiences. All of us who are here today have experienced grief in some shape or form, and it's also true for all of our clients, particularly by the time we get to the age of transition aged youth. There's often many things that have happened in our clients' lives that have brought up grief. And so everyone who comes to you is experiencing this in some form or another. So it's important that we be well versed in what's happening and how we can be supportive when people are in this process. The other piece of this is that when you are working with clients and something occurs that elicits some sort of grief reaction, it's very unlikely that they're going to go seek out someone who specializes in grief. They're going to want to stay with the therapist that they know and already have a relationship with. And so even though grief might not be your specialty, it's very likely something that clients are going to bring to you because they trust you and they already have that relationship. And so again, we want to be able to be present with them in a way that's going to be effective and supportive for them. And even if grief is not sort of the center of the work that you're doing with people, grief can come up in some really difficult ways in terms of exacerbating what your actual, sort of clinical focus is with a client. And if it's not tended to, it can also bring up other issues that sort of add on or complicate what it is that you're already working with. So we want to be able to notice when grief is coming up and work with it. So that's sort of why I think this is a really important topic that we all sort of have some information around. So when I'm talking about grief, what is it that I actually mean? So if you look up the typical definitions of grief, a lot of times what you'll see is something along the lines of the sorrow or the pain that comes up when a death has occurred or when a loss has occurred. And loss is typically referring specifically to a death. I find this definition to be really quite limiting and doesn't actually reflect a lot of people's lived experience. And so the definition that I tend to work with and that I use with clients was developed by John James and Russell Friedman. They developed something called the grief recovery method. And the way that they define grief is that grief is the normal and natural reaction to a loss of any kind. And it's the conflicting feelings that are caused by the end of or a change in a familiar pattern of behavior. So this definition broadens what a grief reaction might come from significantly, a loss of any kind. So we're no longer limited to just looking at deaths. It could be any kind of a loss. And then importantly is this phrase, conflicting feelings. We tend to sort of hold the idea that grief is really about pain and sorrow, when really grief encompasses the whole spectrum of human emotion. And when we leave that out, it tends to result in people feeling like there's something wrong with the way that they're grieving, or there's something wrong with them, that they might be feeling anger, or they might be feeling relief or guilt, because that doesn't fall in line with the standard definition of sorrow or pain. So this is the definition that I'm going to be working from in this presentation and that I like to use with clients. So it's there, and I hope that that will be something you can take with you. And so when grief comes up, there's a number of different types of grief that we might see with transition age youth. The first one is what's just called normal grief. And this happens when a loss or a change has occurred, and it typically has responses that cover sort of all of the domains. So we've got physical responses, emotional, mental or cognitive, and spiritual responses. And what really sort of characterizes normal grief is the idea that over time, the symptoms that a person is experiencing are going to ease up and begin to fade. And the person is going to integrate that loss or a change so that they're able to move forward in a new way. Of course, typically the first few months after a loss or a change has occurred, the symptoms that they're experiencing might be very intense. A lot of times we tend to see a peak of intensity around 6 months. Don't hold too tightly to that number. Many people will experience things on either end of that spectrum. It might take a month or two, it might take 6 years. But a lot of times we can sort of see a decrease in intensity of grief reaction around 6 months. And the symptoms from there continue to sort of drop off. They'll come back in waves, but it tends to decrease in intensity and frequency. And while all of this is occurring in normal grief, a person is able to continue performing just the basic tasks of daily living. They're able to feed themselves, they're able to shower, they're able to get to work or take their kids to school. It might be really difficult, especially in those first few months, but they're able to remain at least somewhat present in what's happening in their lives outside of the loss or change that's occurred. And so anything that is a loss or a change can elicit a normal grief reaction. I have listed here, it's a non-exhaustive list of things that might cause grief. And so just to quickly run over these, death, first and foremost, this is the one that we tend to think about the most when we're talking about grief. Also changes in relationship status, and this happens on both sides of the spectrum. So the end of a relationship, either a divorce or a breakup, but also on the flip side where might be a marriage that takes place, or there might be a reconciliation that takes place. Because this is a change in how the things were, grief can sort of come up as a result of that. And so we want to hold in our mind that it's not just negative things that might elicit grief. It can also be things that we typically view as as really joyous or celebratory occasions like a marriage. Similarly, changes in health status, changes in finances, loss of trust, safety, or faith can also elicit grief reactions. Moving, pregnancy and birth, and graduation or promotion. These are all things that people might experience grief around, and particularly when it is these more joyful things that are occurring, there can be a lot of confusion for people about why they're feeling grief, why they have these sort of conflicting, difficult feelings. And it can be really helpful to give people the information that it's actually really normal to experience that. You might even think for your own selves about times where really wonderful things happened in your life, and there was still some element of a sense of loss or grief. This is true for the vast majority of us. And so normalizing that for people can be really helpful. The next type of grief I want to touch on is something called prolonged grief. And this was just recently added into the DSM. For transition-aged youth, this diagnosis can't be given until it's been more than a year since a death specifically has occurred. And so they've listed out a lot of the criteria that you would need to look for in order to make this diagnosis. I've included some of them here on this slide. But really what we're looking at when it's prolonged grief is the grief has gone on for more than a year, and it has significantly impaired a person's ability to function, or they're able to function, but it takes an extreme and sort of disproportionate amount of effort. There's a lot of thoughts and feelings and people in sort of the grief work community around this being added into the DSM, but it's there. And so I wanted to bring it up for us. If you're looking into the literature around this, another way that prolonged grief is typically discussed is as complicated grief. And so this is something to keep an eye out for because it can bring up a lot of other issues like anxiety and depression. And so if normal grief seems to be going on for a very long period of time and people are significantly impaired in their daily living, this is a diagnosis that we might want to consider. The next type is anticipatory grief. And so this is grief that happens before a loss or a change actually takes place. And this is something that I see people struggling with quite a bit more than the grief that takes place after a loss or a change, mostly because people are not prepared to experience grief before anything has ever happened. And so in this particular type of grief, what you'll often see is a lot more emotional intensity. There tends to be a lot more anger, irritability, a lot of fear and anxiety, particularly if what they're anticipating is the death of themselves or someone else. And along with that comes sort of a cognitive symptom of mentally rehearsing what that expected death or change is going to be like. And that can be very distressing. People feel sort of like there's almost some intrusive thoughts that are coming in that feel overwhelming. Some people will have a feeling of like, if I keep thinking about this, I'm going to make it happen in this way. And so we want to be really mindful of that in anticipatory grief and sort of ask about how people are experiencing that, because it's very often much more distressing than grief that happens afterwards. And so for this, psychoeducation is a really important component of working with clients experiencing this, because it can feel so out of the blue or wrong or really upsetting for them. And so this is one that I think has come up a great deal the last couple of years with the pandemic, where we've had so many people who have gotten COVID and gone into hospital for some amount of time before passing away. This is something that has been coming up a great deal more, and so something to keep an eye out for. And the next one I want to touch on is something called disenfranchised grief. So this is a term that was popularized by Ken Daka, who's done a lot of the research around this. And it's defined as what happens when a person experiences a loss that isn't or can't be openly acknowledged, publicly mourned, or socially supported. And so what that tends to sort of, when this tends to happen is when a loss occurs that's very stigmatized. So when people have passed due to suicide, homicide, or addiction, there's usually a lot of stigma around those deaths. And so people aren't necessarily able to acknowledge how they lost a loved one, or feel the same sort of social supports as if somebody had died from cancer. There's a difference there. That can come up. Insignificant loss is another big one. And this is something to keep a particular eye out for with transition aged youth. A lot of times, like for example, when people get divorced, there's a sense of grieving the end of that relationship. There's a lot of social supports around that. A lot of time transition aged youth are experiencing breakups, but they weren't married, so they didn't get divorced. And that pain and the grief that comes from that is not typically seen or given the same kind of a weight as an older person who was married and subsequently got divorced. And so a lot of these losses in this age range tend to be things that we don't put as much weight on, and as a consequence can be a form of disenfranchised grief where there's not the ability to acknowledge it in the same way and they don't receive the same social supports. Loss of an unrecognized relationship is another one. So this is when people experience a loss of somebody that they can't really be honest about how they were related. So this can happen with same-sex couples where one or both partners weren't out prior to one of the partner's deaths. When people have affairs, or if there was some sort of like polyamorous relationship, people aren't always able to say really clearly, this is what happened, and have the same sort of recognition and supports that come to them. And then non-death losses. And so things that might fall in this category are moving can sometimes fall into this category. Someone going to prison for a length of time can also fall into this category. And so when you notice that people are experiencing losses that might fall into one of these four categories, it's important to attend to that, because disenfranchised grief is often the grief that turns into prolonged or complicated grief, because people are not getting the same supports that they are for non-disenfranchised grief. Continuing with that idea, in addition to the loss itself resulting in disenfranchised grief, the person who has experienced the loss may also experience a form of disenfranchisement because they're viewed as not being able to grieve as deeply as other people. And so this can happen particularly with transition aged youth, where it's assumed that sort of the losses that they're experiencing aren't going to hit as deeply as they are for children or for adults. And it might also happen when the way that a person is grieving is not in line with the social norms. So what I mean by that is, if in a community, the typical way of grieving is someone goes to a funeral and they cry a little bit and they leave. If a person comes in and the way that their grief is coming out is through wailing or screaming, and this isn't part of the social norm, there tends to be a withdrawing of support. There's something that shifts in how the people around them are viewing them and their grief, and there's a sort of backtracking of how they're connecting to them. And so that can happen outside, where externally people are deciding a person doesn't have a right or the capability to grieve. It can also happen internally, where people feel like they don't have a right to grieve what has happened in their lives. An example that I've seen several times come up with transition aged youth is women who become pregnant without intending to become pregnant, plan to not go forward with the pregnancy and then have a miscarriage. There's a loss that's occurred, but there's often a lot of difficulty feeling like there's a right to grieve that loss because they hadn't planned to be pregnant and they hadn't planned to stay pregnant. And so there's a sort of self-disenfranchisement that goes on there, that we want to hold in our minds when people, seem to be very disconnected from their grief. Is it because there's a disconnection for different reasons, or is it because they're feeling like they don't have a right to grieve their experience as it was? And so the last grief I want to touch on here is cumulative grief. And sort of like with anticipatory grief, this is something that is coming up a lot more in recent years, because of the COVID-19 pandemic, where cumulative grief happens when a loss happens, a person begins to grieve it, and then that grief is interrupted because another loss occurs, and so on and so forth. And for a lot of people, this has been happening a great deal over the last couple of years, where something happens and then another thing and another thing and another thing, and there's never the time or the space to really grieve what has been lost from the very beginning. And in this grief, we tend to see really overwhelming or very conflicted feelings, or on the flip side, a really profound numbness because the system is just overwhelmed by what's happened. I think this is probably something a lot of you are already seeing and will probably continue to see for a number of years as we're dealing with what's happened in the past 2 years. So something to keep an eye on as you are working with clients who have experienced a lot of loss. So when all of those losses have occurred, when we've sort of been able to name what might be happening for a client and sort of gotten a sense of, how they might be experiencing their grief and if there's any particular considerations, the next sort of question is, so how do we work with the process? How do we know what a client might be going to experience? And I want to preface this with saying that everyone experiences grief in a way that is ultimately very unique to them, and their process is not going to look like anyone else's. And so the models that I'm going to go over have a sort of order, but not everyone will experience it in this way. And if they don't, that doesn't mean that how they're doing it is wrong or there's an underlying issue. It just means that it's unique to them. But it can be helpful as clinicians when we're in this very gray space of grief to have some idea of how things might go, to sort of hold a little bit of a framework around this. So the first model that I will often use and even share with clients is from William Worden. He developed the 4 tasks. And what he suggests is that there are tasks that we have to move through in order to get to the other side of a loss. And so the first piece of that is just accepting that a loss has occurred. This can be really difficult and might take quite a bit of time to really accept that a loss or a change has occurred. And once that happens, we begin to feel all of that pain that we then sort of need to process through in the second task. And then in the third task, really beginning to adjust to a world without the person that has been lost or the change that has occurred. And finally, figuring out a way to have a connection to what has been lost in a way that allows for connection, but also allows the person to continue to move forward in their life in this new landscape. And what Worden emphasizes is that this is a nonlinear process. It can occur in any order. And so you might have clients who move through 1, 2, 3, 4, and then come back to 1 and skip to 3, go back to 2. And so this is a way to sort of give a sense of how clients might experience things, which can be helpful for some clients to sort of know what they might experience. But it's certainly not expected that everybody is going to go through this in this very stepwise fashion. While this is happening, there's another model from Colin Parks and John Bowlby, who's a big figure in attachment research, that suggests that grief is a reaction to an attachment rupture. Loss is basically a form of an attachment rupture. And so they've developed the 4 phases, which correlate quite well to Worden's tasks, which are this idea that a loss occurs, person experiences the shock and numbness of that. They then begin to yearn for that person, searching for how to be in connection with them, feeling this profound period of disorganization and despair, and ultimately coming back around to reorganization and recovery. And so for people who work already from an attachment model, this can sometimes be a nice model to sort of hold in your mind as you're working with clients from that attachment lens already. The next model, if I can move the slides, yes, is the dual process model. So for both Worden's tasks and Park's phases, many people are going to experience what is called the dual process model, where there's basically two orientations. There's the loss orientation, which is when there's a lot of focus on the loss that has occurred. This is where we're seeing a lot of preoccupation with it. There's a lot of grief or emotional expression that's occurring. And then on the flip side, we have the restoration orientation, which is where a person might actually feel pretty okay. They're fairly engaged in what they're doing. They're feeling pretty level emotionally. They're feeling pretty clear cognitively. And the idea here is that if we were to only be in the loss orientation for the duration of a grief process, it's simply too overwhelming for most people's systems to stay there for a very long time. And yet, if we are only in the restoration orientation, we're not actually sitting with our grief enough to process and integrate it. And so people have a very natural sort of balance of moving between these two orientations. It can feel really unsettling to some people when they notice that they're in a restoration orientation, because there's a feeling like, if I feel okay, well, am I really sad? Am I doing my grief right? And so we want to sort of help people to have this information that alternating between the two is a really natural and adaptive way to go through the grief process. We need both of those orientations as they're working through it. And the last model that I want to touch on is something called the companioning model. This is less about sort of the client's process of grief and more about the clinician's process of sitting with clients in grief. It's developed by Dr. Alan Wolfett, who has done some really beautiful research around grief and supporting people in grief. And he's developed something called the 11 tenets of companioning. I didn't type them all out because they're all quite long. I sort of summarized them, but I would encourage you to go and read about this model if you're working a lot with clients who are experiencing grief. And what he really emphasizes is that when we're doing grief work, we're not fixing clients, we're not solving the problem. Grief itself is not a problem to solve. Really, what we need to be doing is sitting with clients as human beings and deeply attuning to what is happening for them. A lot of times this is taking place in more in stillness or in silence versus talking and action. But there's a real value in being attuned to someone's grief and holding that in the space with them. What we're ultimately doing as people when we are grieving is learning how to integrate our grief. It's not something that we're going to get over or sort of like reach a finish line and kind of put it to the side. Grief is something that stays with us. We learn how to integrate it and move forward, but it's always with us. And so this model really, I like this because it helps as clinicians to remind us that we're not there to fix what's going on for our clients in their grief. We're there to companion them and sit with them in it, ultimately modeling how they themselves can sit in and companion their own grief. And so just to sum up all four of those models, because I know that that's kind of a lot and each one can be quite a bit. Essentially, everybody's going to grieve in their own unique way. Most people, when a loss or a change occurs, are going to experience a period of shock and pain. And they will begin to alternate between periods of real grief and then periods of feeling pretty okay. Over time, a new normal is going to settle in. Grief is still going to come in waves, but typically over time, those waves are going to get less frequent and often less intense until ultimately memories of the person or the thing that has been lost can be sort of viewed without having a huge sort of activation of the system. And people might begin to engage in ways of remembering sort of with intention. There's a lot of rituals that people will develop around remaining in touch with what has been lost while still being very rooted and moving forward in their own life. And as I said the previous slide, emphasizing that grief is not something that we're fixing for clients. We're going to companion our clients in their grief so that they can learn to companion it and tend to it for themselves. And so when we've got transition-aged youth who are experiencing any of that, we've got kind of an overview of what that process might look like as they're moving through grief and sort of how we might sit with them. How do we actually know if somebody is grieving? Besides simply asking, do you feel like you're experiencing grief? many people will be able to tell us. There are some specific symptoms that tend to come up in grief. First, if we take a look at physical symptoms, a lot of times we will see changes in people's sleep and diet, eating too much or too little, sleeping too much or too little. Many people will experience increased physical pain, or they will have sort of random like somatic pain. Because grief impacts the immune system, a lot of times people will have more frequent illnesses. And then they might also experience symptoms like more nausea, headaches, dizziness. Some people will experience light sensitivity. It's really important with all of this, if you have a client who is experiencing any of these physical symptoms and you suspect that they're grieving something, or you know that a loss has occurred, we don't want to immediately jump to assuming that their physical symptoms are because of grief. We always want to encourage them to check in with a primary care doctor to make sure that there's not an underlying physical issue. We don't want to just assume it's grief, because there could be something else going on. And if they get checked out and physically they're fine. One of the things we can do is provide a little bit of psychoeducation around how grief does affect the body physically, and that a lot of people do experience these physical symptoms, because it can feel really unsettling for people when there's a physical symptom that they don't have an explanation for that isn't also physical. And so giving a little bit of information around the fact that that's quite normal can help reduce some of the anxiety that people experience around those physical symptoms. The next is with emotional symptoms. And like I said right at the beginning, there is really no emotion that grief might not include. We've got the ones like sadness, pain, loneliness, despair. There's often, for many people, there's a sense of guilt or anger or numbness. And some people might experience a lot of relief when a loss or a change has occurred. And sometimes people have feelings about their feelings. It sort of feels like they're not in line with what it's supposed to be. And so much of our work as clinicians in this is to really normalize and validate that emotional experience. Because it is normal and it is valid to have this range of experience. And when we can be more open to it, it reduces some of the intensity that comes up around trying to fight their sort of natural and normal grief process. The other piece of this is mental or cognitive symptoms. Often when people are grieving, they experience a lot of brain fog, just a sense of not being totally clear in their minds. People have difficult time making decisions. A lot of people will have very vivid dreams, even if they previously weren't dreamers or didn't frequently have a lot of dreams. Sometimes vivid dreams start to come up that may or may not include the thing or the person that has been lost. And then in the waking hours, people might find their minds wandering more often, or sort of daydreaming, again, about the person or thing that has been lost, or maybe their minds are simply going somewhere else. This is really normal for many people. The last category here is one that we tend to overlook. We tend to get very focused on sort of the emotional or cognitive symptoms of grief, but the spiritual symptoms are a really important place to check in with our clients. When a death or a change has occurred, people might experience really significant changes in their spiritual life. Some people will experience an increased sense of closeness to their spiritual power, or a deepening of their spiritual life. They might feel more connected to or surrounded by their spiritual community. But the opposite can also happen, where there's a sense of complete disconnection from their spiritual power. There might be a lot of anger or rage directed towards their spiritual power. And then subsequently, their spiritual practices begin to sort of lose meaning or become a really complicated part of their lives. And then this can sort of fade into how they're also experiencing their spiritual community, which often is a really key source of support. And if that begins to drop out, they're also losing sort of that social community support aspect. And so I always encourage people to really ask about, if a client has a spiritual life or a spiritual practice, to check in with them about how that's going. And that might sound as simple as, how are you feeling about your spiritual practices, or how are you feeling connected to your spiritual community? And part of what we're assessing here for as well is the idea that when people have a loss of faith or trust, we can have faith or trust in a spiritual power, there's a whole other set of grief that can come from that that's really important to notice and name so that we can hold it. And help clients work through that, because that can be really devastating on top of whatever the loss or change was that happened that sparked this type of spiral. So those are some of the things that we want to be looking for. And what I want to emphasize here is that all of the things that I have just talked about could also be true for adults who are experiencing grief. A lot of the symptoms are pretty much the same. There's a lot of overlap with how children experience grief as well. And yet it's not exactly the same for transition aged youth. There are considerations that we need to make when we're working with this age range. And a couple of things to highlight is, first off, that grief work and research tends to be very focused on children or adults, and transition aged youth a lot of times get lumped into the adult category, but they aren't quite adults, right? There's a reason that we have a name for this age group. There are distinctions here that are important to make. And so they can get sort of caught in between these two groups. And the things that we want to consider when we're working with them are, first and foremost, that this period of life often comes with enormous amounts of change. If you think about what happens in that transition aged time, a lot of the things that I listed on an earlier slide of things that might cause grief are things that this age group is experiencing, one right after the other. And so things like leaving home or transitioning into an adult role in their family of origin home, transitioning into a different educational environment, entering the workforce, graduating, moving up the ranks in their workforce. And then one of the biggest ones is this idea that when transition aged youth hit this period, this is one of the first times that we start to have really significant divergences in what peer groups are doing. So up until 18, people are sort of along the same track. Everybody's kind of moving up in school. People might be getting, high school jobs. People might be getting into relationships, but there's a lot of similarity in what people are experiencing. And then by the time people turn 18 and through this age of 25, people can take very different roads. And in one friend group, you might have somebody who goes off to college, somebody who takes an apprenticeship in the trade, somebody who goes right into the workforce. And then they might be making different choices around when they're getting married, when they're having kids, if they're going to move from sort of where they all grew up together. And so this really changes what the support structure looks like for this age group. People can feel like they're not in line anymore. There's not the same sort of understanding that they had with their peer group. And so as all of these changes are taking place, this group is learning how to navigate that without the same supports that they had when they were kids, and without the supports that established adults have worked to develop for themselves. And they're also experiencing all this change at a much faster pace, and it can often feel much more intense for this group because it is just one thing after another. So we want to hold that in our minds when we have transition aged youth who are experiencing grief, is that it's very often not just the one thing. There's a whole set of things that have happened for them that is the backdrop of the grief that they're bringing forward. And the second piece of this that we want to hold in our minds is that grief is very frequently re-experienced at developmental milestones, and transition age youth are in this really key place where they're reaching this milestone of their brains finishing developing. And so what's happening is that a lot of times this group will be re-experiencing grief that they had already experienced as a child, but with their brain that's finished developing. And the other side of this too is that sometimes there are things that happen that we can't grieve until there's the time or space from them. And transition aged youth are in this really interesting time period where they're, for the first time, looking back on their childhoods. And it might be the very first time that they've ever had the space or the time to really sort of grieve what happened then that they might not have been able to at the time. And so those are things we want to be holding for clients when they're coming in and experiencing grief and they're in this age range is what happened in the past that might be coming up now, and normalizing for them that it's very normal to re-experience grief, to feel like you've gotten over it and you've come to terms with it, and then to all of a sudden feel like you're back at square one. Part of that is because of this piece of their brains at this really key developmental milestone, and also because when we've got time and distance, it looks different, and so we need to reprocess it and reintegrate it in a different way. So all of that said, to wrap up, here are 3 different interventions that I use a lot with this age group when we're working with grief. The first, and one of my favorites, is something that's called a loss timeline. And so this builds on the idea that grief is cumulative, which is separate from the idea of cumulative grief. What I mean by grief is cumulative is because we don't get over or like get out of grief, we only integrate it. Once we have some grief and more comes along, we're just sort of adding to our store of grief, if you will. And so sometimes when people experience a loss, there's a grief that will come up that feels really disproportionate to the actual loss that has occurred. And very frequently, that's because there are many losses that came before that the grief around that wasn't articulated or tended to. And so a loss timeline is a way to get a sense of what actually has gone on for a client, can help contextualize what it is that they're experiencing. And it can also point us towards the areas that there's grief that we really do need to sit and spend some time with. So I have an example here from, let's see. Oh, sorry, my buttons are having a moment here. Oh goodness. Going to go back to here we are. So I've changed the name and identifying details, but this is a client that I worked with who had been working with me for something completely unrelated, and then learned that his mother, who he had been estranged from since he was 8, had died. And he had an enormous grief reaction. And he came in and described feeling like he kind of understood some of why he was feeling the way that he felt, but he also was feeling all of these feelings, all of this grief that didn't actually feel connected to what this loss was. And so I asked him to go back and to using a similar list to what I shared earlier of types of losses or changes that could elicit grief, to list out, since he had turned 18, what were the things that had been lost or changed. And so he came up with this list. And when we were looking at this, it makes so much sense that there would be enormous, profound, deep amounts of grief. But because so much of this had happened so quickly, and because some of these were really positive things, and some of these were very negative, but very stigmatized things, there was a lot of grief that had not ever been really tended to, that hadn't actually been grieved. And it had all been building up to a point where when a loss finally did occur, it was sort of like the straw that broke the camel's back. And there was all this grief that needed to come out, and we needed to connect it to what the actual loss was so that he could mourn the losses and the changes that had occurred in a fairly short period of time. So I often will offer clients to do this when I'm working specifically with transition-aged youth. A lot of times we will start with, tell me what's happened since you turned 18. We'll sort of work in smaller chunks. You could offer to, clients to do it from their first memory, but sometimes that can be a lot, and it isn't always as, depending on what they're bringing in, it might not be as relevant to sort of take that big picture. Sometimes we want to start a little bit smaller. So with transition age youth, a lot of times I'll say, let's do a loss timeline from the time that you were 18. And if clients say, oh, I'd like to do a longer one, or I think there's a different period of time that feels relevant, then we want to go with that. The next timeline the next timeline. The next intervention, I don't have an example of this because all of my clients have theirs with them, but essentially it's this idea of a memory box and a grief drawer. And this draws from the dual process model of a loss orientation and a restoration orientation, as well as Warden's 4 tasks of accepting a loss, working through the grief of that, and then also moving forward in life with that grief integrated. And so what I ask clients to do for this, in a memory box, we put some sort of reminder of all of the positive aspects of the relationship to the person, thing, or time that has changed or has been lost. And a lot of times people won't have, physical objects. So we will make objects, or they'll write, things on scraps of paper. And then conversely, we'll do a grief drawer where it's all of the negative aspects of that same thing. This can help sort of bring grief, which is this often very internal sort of abstract process, into the physical world. It can make it a little bit easier to kind of sort through and go through that process of articulating both sides of this loss. And then in this, we can sort of help normalize for clients that it is so much a normal part of grief to be experiencing, remembering really good things, and also struggling with the things that weren't perfect about what has been lost. And the last intervention, and one of my absolute favorites to use with transition-aged youth, is the Who Am I intervention. And so this is a 4-question intervention. It starts with, who was I before? Meaning, who were you before the loss or the change occurred? Who was I then? So in the period of time that the thing, the person, or the time was being lost, who were you in that moment? Who are you now in this moment? And who do you want to be in future? And so this is a way to really honor sort of the whole process that people are in, because a lot of times when grief comes up, we get very focused on what is happening for you right now in this moment. And because grief can be so uncomfortable, we want people to sort of move towards feeling all of that less intensely. We want to sort of move them into a place where they feel better. But then we neglect this piece of, they were somebody before this loss or change occurred, and they were somebody during that. And we really want to be able to bring that forward and honor that. And so I will offer these questions sometimes as individual journal prompts, but also for transition-aged youth, one of the most well-received ways that I have offered this is to find a song that represents each of these. For my more visual clients, sometimes we'll do art pieces that sort of represent the answer to each of these questions. There might be sort of a pose or a movement that goes along with it for my more sort of experiential or somatic clients. But the song one has gone over particularly well for many. And so I have an example here. This was a client, again, identifying info has been changed, but her partner died early in the pandemic. They had been dating since she was 14, and her partner passed. And so I had asked her to take each of these questions and come back with a song that felt like the answer to it, and to highlight for me what are the lyrics that really sort of represent the answer to this question. And music is such a powerful way to communicate. There's a lot that can go on in music that doesn't quite sound the same when we're just talking. And so this can really help clients to feel not only like there's a way that they can sort of have that deeper sense of attunement or expression, but also that they are not the only ones who have felt a version of this, because there are people who have written songs about it. So I have really enjoyed this. I often learn about new music that I would never have known about, and can hear and feel it in a different way than if we're just talking about it. So that is what I've got. We have time for questions if there are any.
Thank you so much, Hart. This was such a beautiful presentation. We do have a few questions that we'd love your input on. One is, how do you think grief affects development?
Oh, that's such a great question. I think a lot of that depends on how the grief is responded to. I think that grief is a really natural part of development because it's part of being human. And so if a grief reaction comes up and it's really seen and validated and tended to by the person and by their community, I think that can be a really positive aspect of development. If the opposite occurs, though, I think a lot of times people experience a sense of getting stuck where they were there. And there's a lot of interesting research being done on sort of the neuroscience of what happens when we grieve that I'm sure will give us more answers around that. But I think for people who aren't well responded to, or sort of have a sense of not being able to grieve, there can be parts of them that get stuck in that we need to go back and sort of tend to and sort of bring them forward into where the person actually is developmentally.
Okay. So if there's companioning with the grief afterwards,
Yeah.
developmental process will most likely continue on a normal trajectory.
Mm-hmm.
And if
Yeah.
there is not, then perhaps there will be some stuckness that happens, or
Yeah. And if that loss is integrated into who they are, they move forward with that, versus if the loss is not integrated, they sort of there's a piece of them that gets stuck holding that non-integrated loss.
Wonderful. And how would you recommend, so say there's a family loss of like a caregiver loses a child, therefore a young person loses a sibling.
Mhm.
How would you recommend that be approached in the family? Because somebody was chatting in, sometimes caregivers are in so much in their own grief that it's really difficult for the other child or others to kind of move forward. And what do you have any thoughts there?
Yes. It's so hard when there's a loss that a family experiences, because everybody is going to experience that in different ways. And it can really, for the older adults in a family, their grief can be so consuming that it's hard for them to parent their children, or even their adult children, through that particular loss. And so specifically when I'm working with transition aged youth who have lost a sibling and are experiencing in some ways a double grief of feeling like their parents are there, but they've lost access to their parents.
Mhm.
What I really encourage those clients to do is to connect with other adults in a family. A lot of times this is where extended family can be really helpful, of connecting with aunts, uncles, grandparents, godparents. And this is also a time where if they've got sort of peer support, we really want to bring that in. And we talk about how to share with peers what has happened. Because wherever we can pull in that support, we want to. And then hopefully over time, when the grief gets to be a little bit more manageable, if there's ruptures that have occurred in a family because grief got in the way of being able to be connected, we can come back and manage that. But in that initial period, it's really about seeking other sources of support for the client.
Wonderful. Thank you so much.
Yeah.
We do have a question here. What intervention would you suggest for young children ages 4 to 11?
Oh gosh, none of the ones that I just talked about. With young kids, a lot of times the grief will present fairly differently, and it tends to they tend to sort of bounce in and out of it very differently. Sort of this idea of loss or restoration orientation, they tend to bounce in and out of that much more quickly. And there's a lot of developmental considerations that we want to make when working with really young kids. Probably like a 2-hour answer to this question. But one of my favorite things to do just quickly is there's an author, Marge Heegard, who has written interactive books that kids go in and fill out, sort of like a prompted journal. And it sort of talks about loss in ways that are developmentally appropriate, and sort of gives us a space and structure to helping understand where that child is, and sitting with them wherever it is that they happen to be. But it's such a good question, but so much more that we would want to get into. But Marge Heegard, I really like her book and have used that with my younger kids, because it's helpful to have some structure there.
Would you mind chatting in the name?
Yes, I hope I'm going to spell her last name right.
Oh, okay. Connor will send a link. Never mind. Marsh, you.
Okay.
Thank you. That's very helpful.
Yes.
Thank you so much.
Yeah.
There's a question. We have two more questions. I think we have time. We do. Great. One is, what do you, there seems to be some blurriness around the idea of grief and clinical depression in transition age youth. And what do you
Yes.
think about that? And where do you kind of consider treating depression and the grief and that relationship?
Yeah, I think that's such a good and important question, particularly for this age range, where this is often when we're seeing a lot of other sort of clinical issues that are popping up.
Mhm.
I will say it can be really tricky to sort of parse through what is a grief reaction and what is truly clinical depression. And so the way that I tend to go about that is I will often assume that we probably have elements of both. I think it's really important to do very thorough assessment around depression, because if that is something that's present, we're going to want to deal with that in a slightly different way. But a lot of times I will normalize that, if there is this untended grief, it might come up in this way. We can work with the depression, but let's not sort of take it out of context of where it's come from. So whether the depression is a totally separate issue, or if it's connected, or because there's grief that's gone untended and unintegrated, we want to know that we're treating a whole person, right? We're not treating a diagnosis. So very thorough assessment, but also using loss as a way to sort of contextualize what's happened and bring in the idea that there are elements of what a person might be experiencing that we really need to learn to sit with versus fixing, if that makes sense.
Yeah, great. Thank you. So assessing and integrating both kind of concepts. Wonderful.
Mhm.
Any particular interventions that you would recommend for transition age youth and foster care? So we know that child welfare kind of in and of itself can bring on a variety of losses and grief. So do you have any thoughts there?
Yes. I think here is where a loss timeline can be really helpful. And when I've done loss timelines with this particular population, a lot of times we are very focused on, can we name the non-death losses that have occurred? And can we we have a lot of ritual in our society around death loss. We don't have the same for non-death losses, which are often so much of what foster youth are experiencing. And so what I often like to do is, let's find out what has actually happened. What is it that you feel like has been lost? And then can we develop a ritual around that? Is there a way to have a funeral of sorts for the
Mhm.
thing that has been lost? There's a reason that we have funerals, right? The ritual of that is so powerful. And so a lot of times we will sort of work in sessions towards, if you were gonna have a remembrance or an observation or a memorial for these things, what
Mhm.
might that look like? And then actually either do it or invite them, with peers or with other supports, to have a moment of, join with me and sort of remembering and honoring what's lost and who I am now because
Mhm.
of it.
Right. So thinking about those non-death losses, which could entail ambiguous loss or anticipatory loss as well, right?
Mhm.
Can be really helpful in having some kind of goodbye um,
Mhm.
in this case, which makes me think about young people experience, transition age youth experiencing divorce in their home or other kinds of non-death losses.
Yes. Yes.
Wonderful. Okay, thank you. Okay, what do you as a clinician and grief work do to prevent burnout and increase self-care? That's
Oh,
something.
that's a great question. Can I come back and talk about that for an hour? That's a really wonderful question. I think one of the most important things is to be in community with other professionals who are working with similar issues or with similar populations. We hold a lot of really intimate, profound experiences for our clients that we can't take out into the world and talk about the way that other people can. And just like for our clients, where so much of grief work is about companioning them and sort of sitting with, just validating what's true for them, we need that too, as we're taking that in from their experiences. So definitely being in connection with other mental health professionals, and then taking some time off, not working to the point where you feel like I can't come back anymore, but being intentional about having some space on a frequent basis.
Love it. So get some space, take some time off, and also be in community with others doing similar work can be so helpful.
Yes.
Thank you, Hart. Thank you so much for presenting today. You're
Thank you
amazing.
for having me.
Just going to look at a few upcoming events through CTAC. Tomorrow, we have social media use and mental health among sexual and gender minority youth. That's tomorrow at 12 if you want to join us then. We have assessing and treating non-suicidal self-injury, Tuesday, April 19th. Trauma and addiction, a 2-hour training. It's going to be fantastic with Jan Winhall on April 20th. This is really looking at the polyvagal theory and addiction. And then we have conversations with Dr. Tony featuring Cindy Stanford, who started an organization called ACEs Matter. So thank you everyone so much for being with us. Once again, reach out to us if you have any questions or concerns. And most importantly, we hope you enjoy the rest of your day. Okay, take care. Bye, Hart. Thank you.
Thank you.
Bye.